Hello and welcome. I'm Dr. Lakshmi and you're watching the Health Talk session by Yashoda Hospitals. You probably don't think about your shoulders much until you experience pain in one of them. Shoulder pain can make a simple act like brushing or dressing seem like a monumental task. As you age, you're more likely to experience shoulder pain from different conditions. So let's discuss about shoulder pain and its causes in our today's episode. Joining us today, we have with us Dr. Deepthi Nandan Reddy, Consultant Orthopedician Surgeon from Yashoda Hospitals, Hitec City. Welcome to the program, Doctor.
Thank you very much.
So, Doctor, shoulder pain is one of the most common complaints we hear from patients. So, what do we mean by rotator cuff tear and whom do you think are at risk of developing this?
Rotator cuff tears are usually seen in patients who are above 40 years of age, and the most frequent perception people have is that this occurs in sportsmen, but actually this is seen in most of the general public. And rotator cuff is basically the main muscle which controls your shoulder, the ball of your shoulder. And it comprises of four muscles. There is a muscle in the front which is called the subscapularis, muscle on the top which is called the supraspinatus, and there are two muscles at the back which is infraspinatus and teres minor. When there is a tear of one of these muscles, the function of the shoulder is altered, and that causes pain and disability in the shoulder. What I mean by disability is that the patient will not be able to lift his hand up and will have pain whenever he lifts the shoulder or arm up over the shoulder height.
I'm sure not everyone with a shoulder pain will see a doctor right away. So when do you think one should seek medical attention immediately for a shoulder pain?
So the most frequent way the patients present is that they would have had a fall while doing things, or where their arm is pulled. Suddenly they feel a sharp pain in their arm, and when they feel this pain, they start noticing that they will not be able to lift their arm up. This is when you should suspect there is a tear in the tendon in your shoulder. Majority of the time patients go to a general orthopedic surgeon who gets an X-ray done, and they say everything is clear, and they give you some pain medication and send them home. But these are the patients who have a normal X-ray and are not able to lift their arm up, are the ones which probably have a tear in their tendon. So they need to see a shoulder specialist who will examine their shoulder, assess the rotator cuff, and come to the diagnosis of a tear. Many a times we get a investigation like an ultrasound or an MRI scan, because these are the tests required to diagnose this problem. But most of these diagnoses can be done with a simple clinical examination.
So doctor, most of the shoulder pain is because of an injury, but are there any other conditions where shoulder pain is not associated with an injury?
Yeah, sometimes you can tear the rotator cuff even if you don't have an injury. There are some group of patients who come and present with a painful shoulder but has never had an injury to the shoulder, and they are always perplexed about why they have this tear. Now, the rotator cuff is a tissue where some of the blood supply to that tendon is not so good, and there is a problem in some patients where they have an extra bone on the top of the shoulder, which is the acromion. When this bone rubs on the tendon, there is a gradual thinning of the tendon, and suddenly this tendon tears. This is similar to wearing a sock and you have a hole in the sock after using for a long time. So prolonged rubbing of the tendon between two bones causes thinning of that tendon and ruptures it. If that ruptures, there is no need for an injury to happen, but we can assess this tendon tear again with good examination. So examination of the shoulder physically is the most important way of finding out what the problem in the shoulder is.
So doctor, do you think that surgery is considered for every rotator cuff tear, and if so, do they heal like every other muscles?
So majority of the time rotator cuff tears are treated with surgery, because we are trying to restore the anatomy of the shoulder. A normal shoulder to work requires all the 4 muscles to be intact. Some of these may not require surgery when the tear is too small and is involving only part of the tendon of one of the muscles. But if the muscle is ripped off the bone and that needs repair, it has to be done with surgery. If we do not do the surgery at that point of injury or at the point of presentation, if it is left alone, that muscle becomes small over a period of time. So, when it becomes small, it is very difficult to repair it at a later date. So, we have difficulty with patients who come at a late stage and ask us to repair those tendons which are not in good condition. So, it is preferable to do these surgeries early on, and it is preferable to diagnose them early, so we do not miss the diagnosis.
So what happens when rotator cuff muscles are ignored or not treated surgically, doctor?
If surgery is not considered and they are left alone, the muscle which is ripped off the bone starts shrinking in size and becomes smaller, and then the muscle next to it starts tearing. It is like a cloth. When you have a small tear and you pull it, it will become bigger. So, these tears get bigger in size, or when you have a trivial injury, tend to become big shaped tears, and then they will not be able to lift their arm up, and they have difficulty with all their activities, and they will typically have pain at night. And these patients, when they progress like that for years, will have what we call arthritis in the shoulder, when the shoulder ball starts to ride high and it will load the upper part of the socket and will cause arthritis. And in that situation, a repair of this muscle cannot be done, and we need to replace these joints. So, a surgery which could be a small repair of the tendon, if left alone and not treated correctly, can lead on to a replacement of the joint, which is a much bigger operation.
So, discussing about surgery, what are the recent advancements in this field of surgery for repairing rotator cuff tears?
We have been traditionally fixing or repairing these tendons by open surgery, which was the gold standard of doing this procedure, but advances in shoulder surgery like arthroscopic surgery, advances in instruments and implants we use like anchors we fix the tendon onto bone, has changed the way we treat these conditions. So, currently we do arthroscopic repair, where we make small holes in the around the shoulder, and we introduce the telescope or the arthroscope through it, visualize the joint properly, and use these small cuts to repair these tendons. So, from the outside the patient will only have few cuts, and that is typically in layman's term is called as a keyhole surgery, or even sometimes laser surgery, although there are no lasers used in this surgery.
So, doctor, what are the general measures that one should follow, especially in the post-op or recovery period?
So, like any torn tissue or a broken bone, the healing of the tendon onto bone takes around 5 weeks. So, unlike other surgeries where you operate and they can start walking immediately or using the arm immediately, in this surgery we need to rest the arm so that the tendon and bone heals properly. Once the bone and the tendon heals well, we start rehabbing the shoulder. What I mean by rehab is that exercises to strengthen that particular group of muscles, so it has the strength to lift your arm up and can do your normal functions. Most of the time patients go back to their normal activities and are able to do most things without any difficulty once the tendon is healed. Of the few hundreds we have done, we have reviewed our patient recently, and we found that 95% of them do very well, and they get back to their normal function, including swimming and overhead activities.
So, before ending this episode, doctor, what message you would like to give to our audience out there as far as rotator cuff tears are concerned?
The most important message I would like to give is that these injuries, if they are picked up early and fixed early, they will have a good outcome later on. So, I say stitch in time saves the shoulder.
So, thank you, doctor. It was wonderful having you here on our program today.
Thank you very much, Dr. Lakshmi.
So, this brings us to the end of this episode. Hope this episode was informative on the topic shoulder pain and its causes, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.